if you've got a senior loved one, someone whom you care a lot about, and maybe they've expressed to you concern about the future. They want to stay home. They don't want to go to a nursing home, or they want to be able to look at their long-term care and sort of kind of fashion it themselves. With us is Kathryn McGuire. She's the Senior Vice President for Behavioral Health, Home and Community Services for Rochester Regional Health. And boy, times have changed when it comes to how we consider what long-term care really means in this country, right?
Sure has. When I think back to the start of my career at Rochester Regional Health in 1990, the solution was for the state to build more nursing home beds here in this region. And right about that time, we were also seeing the development of adult daycare for the first time in Rochester. And now, over the last several years, the state has really kind of morphed into a thought that people really want to stay at home. You've seen, during the 1990s, the development of senior housing and assisted living. And now the state has really moved towards, developing programs and advocating for programs that keep people in the community, that manage their care in a comprehensive, coordinated way. And, we feel really good about that because we've been doing it for 25 years. 25 years ago, ElderONE was born at Rochester Regional as an answer to helping people get out of the hospital and avoid nursing homes. And we were leading the way. We were the 9th in the country. And now there are 104 programs around the country. And the state is really saying, hey, these programs keep people out of nursing homes. They help coordinate medical and health and social services and let people stay where they want to live, wherever they call home, whether it's in their family home that they were born in, or in an apartment, or a home with family or others.
You mentioned people wanting to be home, and I know a lot of people do, but for the caretakers it can also be a little bit intimidating. But there is help out there. How do you go about finding that help? Well,
I think that it's a really important issue for caregivers to get educated and get educated early. Oftentimes caregivers wait too long and they find themselves burned out, and their family member almost feeling like they have to move out of the community. And so know that there are services that help caregivers support themselves, that will give them education and information that will help them to seek services in an educated way, and make sure that generations get to stay together. A lot of times adult caregivers are sandwiched between their children or their grandchildren and their adult parents.
It's possible to have this care at home. My grandmother lived with us for many years when I was in my early and mid-20s, even as far as my late 20s, and I lived at home. So I had my grandmother in the house, my sister in the house, my parents, and we were all living under the same roof. I will say this, that having her at home, those were really great years for her and for us too. I mean, it was a little bit of a trickiness, how to figure out who's going to do what and where, but it was really great. And so it's possible. It's possible to do this. If people are watching this and they're thinking, how do I want to consider this for my loved one. You're saying make plans now, right? What can we do now to sort of ensure that this is the case in the future?
Sure. Well, seeking information on the web, making telephone calls, going to senior events where information is available, visiting adult daycare, or visiting assisted living, or visiting programs like ElderONE early, before you think you need it. So
crisis,
because so many times people find us because they're in the hospital and they think they don't have a choice but to go to an institution, and there's so many alternatives.
And this is people coming to your house to help you, right? There's a...
Yes, if you ElderONE is a program that's like managed long-term care programs within New York State. It's comprehensive. It's paid by both Medicare and Medicaid, and it covers medical care, so physicians and nurse practitioners, nurses, social workers, dietitians, therapists come to people's homes. We also have what we call a PACE center. It's the Program of All-Inclusive Care of the Elderly. It's a center where people can socialize, where they can get their exercise, their health care, all in one place.
That's great.
Where do we find ElderONE online?
So you can go to rochesterregionalhealth.org, and under Senior Services, you'll find all the information not only about ElderONE, but also about other comprehensive home care, nursing home, adult daycare, and our senior housing.
So it covers the spectrum. There's many ways to look at aging in place, right? And aging. You can, you are the craft. You can craft your own future if you're careful and you do it early.
That's
Thank
the
you.
key, to get the care that you need when you need it from in the right location at the right time.
Thank you so much.
You're very welcome.
Appreciate it.
Thanks for having me.
We're going to take a break. When we come back, a look at